Thank you for the opportunity to present our work at this conference. I'm Liz Graham, a Senior Research Fellow at the Academic Unit for Ageing and Stroke Research, which is part of the University of Leeds and based at Bradford Teaching Hospital's NHS Foundation Trust. Colleagues detailed on this slide and I have undertaken work to identify the research priorities of community-dwelling older people living with moderate to severe frailty. Whilst community dwelling encompasses those who live in their own homes, in supported living or in care homes, in this presentation I focus on the priorities of those who live in their own personal homes. This work is part of a wider programme of work undertaken by the Older People with Frailty theme within the NIHR Applied Research Collaboration Yorkshire and Humber. The population of older people is increasing, which means that the numbers living with frailty is also rising. This demographic shift means that there is an ever-increasing demand for health and care services to meet older people's complex needs. However, there is limited research activity underway to direct and support their needs. Improving healthcare for older people is now being prioritised by governments and funders, and it is important to focus these research efforts on areas that are deemed important to older people themselves to ensure that their needs are addressed. However, there is limited evidence about the priorities for research to address the needs of older people living with frailty. Our research group within the Applied Research Collaboration Yorkshire and Humber set out to identify these priorities to inform subsequent intervention development work, developing interventions to prevent or reduce frailty. We started with a review of the literature to identify existing priorities. Using a fairly broad search strategy, we searched databases such as Medline, Embase and PsycInfo, as well as relevant policy and guidance documents and charity commissioned reports. Using the findings from our literature review, we designed a survey which we sent to older people, carers and health and social care professionals with the aim of identifying their top priorities. We were able to contact a large number of older people through the Care 75 study, a national cohort study of older people aged over 75, which is coordinated from our research unit. Those participants who had agreed to further contact about other work and who had been recently classified as living with moderate to severe frailty were sent the survey. This meant that we had a very representative group to consult. Finally, we held discussion groups with older people to explore and understand the meaning of the top priorities in more detail to inform our intervention development work. We will continue to work with older people, carers and health and social care professionals as we move into this phase of the work. Today I'm presenting in brief the findings of the literature review and the surveys. Following screening of titles, abstracts and full papers, 60 articles were included in our review. A further 11 articles from other sources, such as charity commissioned reports, were also eligible and included. Of interest is that only 6 specified frailty, despite many more being relevant to this population, which is why we didn't limit our search strategy by including frailty terms. Content analysis of the extracted data identified non-specific general priorities, such as novel models of care, as well as more specific priorities, such as better interventions to manage incontinence. It is these specific priorities that we included in our survey because they would be more meaningful to respondents and because we were aiming to identify specific priorities where intervention development could target areas requiring modification. We're aiming to publish our literature review findings shortly. "141 older people identified as living with moderate to severe frailty were sent the survey and 87 responded, a really good return rate of 62%. Their top priorities were staying in my own home, living in my own home for as long as I can with support if I need it, and staying independent, being able to undertake daily and social activities. 89% and 80% of respondents respectively said that these areas were very important to them. Another 10 areas were identified as being very important, and we sent out a further ranking survey including these 10 items to older people to narrow down their top priorities. In parallel, we sent modified versions of the survey to carers identified via carers groups and to health and social care professionals contacted via professional bodies. We received responses from 31 carers and 119 health and social care professionals. We looked at responses from all groups to identify the priorities that all agreed to be very important. Presented below are the top 3 priorities. These are having more joined up care so that all health and care needs are considered together and the right help can be obtained at the right time from the right person. Health and care professionals having a better understanding of the experiences and needs of older people. Making decisions about care with family or friends, carers and health professionals so everyone, including the older person, is involved in decisions about care. Our literature review provides a concise summary of research priorities and will be a valuable resource for researchers who wish to develop research of relevance to older people living with frailty. Our surveys identify the priorities that are most important to older people living with frailty, providing focus for future research. Discussion groups with older people have explored the meaning of our top priorities, and we have started intervention development work. Interventions that align with their priorities will be co-produced with older people, carers and health professionals. Thank you very much for listening, and I would like to thank all those who contributed to this work by returning surveys and taking part in discussions. If you have any questions or comments, please do get in touch with me using the email address shown on this slide.